Hi! Today we're going to talk about the newly found virus COVID-19, aka SARS-CoV-2. The spreading of this virus has caused lockdowns in most areas of the world, just like our country, Philippines. During this pandemic, it is important to be aware, prepared, and be well informed. If you're ready to learn, let's get started. What is COVID-19? COVID-19 is a virus commonly known during these times as tiny organisms. This means that these tiny organisms can pass through your body and make you become its host organism. This kind of virus can be spread from one person to another. Like any other viruses, COVID-19 likes to multiply and spread to make sure they survive. When they get inside our systems, they are most likely to affect our lungs. They will target the alveoli, which are tiny little air sacs found in the lungs, and they will spread the virus in the alveoli, effectively reducing the function of our lungs, which can be seen in other COVID-19 positive patients. These types cause illnesses in animals and humans, particularly respiratory infections, starting with common colds to severe diseases. The World Health Organization then declared this as a public health emergency of international concern. From there, it has been classified as a novel, meaning new, coronavirus. It turned the heads of the whole world when it was declared as a pandemic on March 11, 2020, due to the rapid increase in the number of cases outside of China. Persons of all ages are at risk in having COVID-19, from children to the elderly. What we need to look upon are the populations that are at most risk to the COVID-19, such as the geriatric population, pregnant women, and smokers. As of July 20, 2020, World Health Organization or WHO determined there have been a total of 14,043,176 confirmed cases of COVID-19 globally, including the 597,583 deaths due to COVID-19. In the Philippines, the first reported case of COVID-19 was on January 30, 2020, from a 38 years old Chinese national. By March 7, 2020, the first local transmission was reported. As of July 7, 2020, the World Health Organization determined the total number of confirmed cases has reached 47,873, with 12,386 recoveries and 1,308 deaths. To date, there are no specific vaccines or medicines for COVID-19. Treatment for the disease are currently under investigation and are tested through clinical trials.
During this pandemic, it is not enough to know what the COVID-19 virus is. We must also be aware of how the virus spreads. COVID-19 primarily spreads from person to person through droplets released when someone is sick, sneezes, or coughs that can land on the mouths or noses of people nearby, but it can also be left on objects and surfaces such as tissue, doorknobs, digital devices, pens, laptops and mouse, and elevator buttons. So if you touch something contaminated and then touch your face or another's face, you might all fall ill. This is why it is important to know of the different ways to protect ourselves and others. Keep in mind that the fight against COVID-19 is far from over. The pandemic hasn't ended yet, and until there's an effective vaccine or treatment, everyone remains at risk for acquiring the virus. In some places, as cases of COVID-19 go down, some control measures are being lifted, but it doesn't mean that we should go back to the old normal. If we don't stay vigilant and protect ourselves and others, the cases may go up again. We must continue to practice protective measures wherever we are. Whether at work, home, or school, we can prevent the spread of coronavirus by physical distancing, covering coughs and sneezes by using a tissue and throwing it away properly. If you don't have a tissue, it is better to cough into your elbow instead of your hands. Another way to protect yourself is to perform frequent hand washing. Hand washing using a soap and water is especially recommended if your hands are visibly dirty. Do this for at least 40 to 60 seconds. You can engage kids into hand washing by telling them to sing a tune while washing their hands so they are more likely to comply with frequent hand washing. If the hands are not soiled, using rubbing alcohol and hand sanitizers are okay. The next method is to avoid touching your face, avoiding crowded places and limit time in enclosed spaces, keep a distance of at least 1 meter from others, and isolate yourself from others if feeling unwell and seek care if needed. Before COVID-19, we may not have considered how close we stood, walked, or sat near other people. Now, it is important to keep a distance from others to limit the spread of coronavirus. Important to know that the symptoms for COVID-19 may not be present immediately. Some people are highly contagious and can infect those around them. The symptoms for COVID-19 can be mild to severe, and there are others who may also be asymptomatic or without symptoms. More severe cases may result in pneumonia, organ failure, and even death. 80% of people would recover without needing special treatment. Personal protective equipment is used to prevent transmission of COVID-19, not only in the hospitals, but also in the other high-risk public areas. In the event that the PPE becomes damaged, replace it immediately. Lastly, when caring for a patient, adjusting or touching the PPE should be avoided as well as touching your face.
Were you able to understand our brief discussion regarding COVID-19? Well then, we hope you were able to educate yourself regarding the pandemic we're facing right now. Always remember to stay at home, wash your hands, and keep your distance.